Now, I've talked before about a range of drugs being trialled as treatments for the coronavirus, and one of them is hydroxychloroquine. This drug's been used for decades against malaria and immune system conditions such as lupus and rheumatoid arthritis, so it is safe to use. Some doctors in China, the US and Europe say it's worked well at controlling COVID-19 symptoms and keeping coronavirus patients out of hospital. But then again, most people infected by this virus don't seem to get severe symptoms anyway and don't end up in hospital. There's been a big media backlash against this drug, though, mainly because Donald Trump dared to speak positively about it. As we've seen on the weekend, and I predicted this on Friday's show, the media went nuts about the US president's weird and unclear musings about light, heat and disinfectant. Supposed reporters, grown adults, actually reported that Trump's musing was a recommendation to inject disinfectant into COVID-19 patients. That's how irresponsible these Trump-obsessed journalists are. Anyway, there's been some fresh reporting on hydroxychloroquine, saying US authorities have recommended against its use. That's not quite the case. The US body, the COVID-19 Treatment Guidance Panel, notes ongoing studies and has not recommended for this treatment. But it goes on to say, at present, no drug has been proven to be safe and effective for treating COVID-19. There are insufficient data to recommend either for or against the use of any of these antiviral treatments for COVID-19 patients. That's the important point. They don't know enough to recommend for or against. Meanwhile, many doctors are using it overseas, and as I reported a couple of weeks back, supplies are low in Australia because doctors and dentists have been prescribing it for each other or to have on standby for their families. Clinical trials are now underway at the University of Queensland and at the Walter and Eliza Hall Institute in Melbourne. I, for one, don't care whether Donald Trump likes it or Kim Jong Un recommends it or it's a favourite of Jacinda Ardern's. I just hope this or some other drug works.